Welcome. I am Dr. Raju Devde, Professor and Head of the Department Pharmacology, Kaktiya Medical College, Warangal. Today the topic is Introduction to Autonomic Nervous System. This topic I would like to cover under the following contents: Introduction to ANS, Central Organization, Anatomical aspects, Physiological aspects, and Neurotransmitters and Receptors. So by the end of this session, the phase 2 MBBS students should be in a position to know the brief introduction of ANS, what are the central organizations of autonomic nervous system, little bit of the anatomical and physiological aspects, what are the various neurotransmitters involved in the autonomic nervous system, and what are the various receptors. Now, the central nervous system or the nervous system, it is broadly classified into the central nervous system and the peripheral nervous system. The peripheral nervous system further is divided into somatic nervous system and autonomic nervous system. And this autonomic nervous system is classified into sympathetic and parasympathetic nervous system. So central nervous system, it consists of the brain, the spinal cord, and the peripheral nervous system divided into somatic nervous system, which is the voluntary nervous system, the nerves which supply the skeletal muscles. And apart from that, you have this autonomic nervous system, which is broadly divided into two, which is called as the sympathetic and the parasympathetic nervous system. And this autonomic nervous system is not under the voluntary control, and therefore it was named by Langley as autonomous, or atos means self, nomos means governing. So this autonomous, autos means self, nomos means governing, which is a Greek word. And if you look at this autonomic nervous system, which is not under the voluntary control, is further divided into two, that is sympathetic and parasympathetic. And this autonomic nervous system is also called as visceral, vegetative, and of course involuntary nervous system. In the periphery, it consists of the nerve ganglia, the plexus that innervate the heart, the blood vessels, the glands, the visceral organs, smooth muscles in various tissues. Okay, and if you look at the autonomic nervous system, the two divisions which I told you, that is the parasympathetic and sympathetic, have opposing effects, and normally their effects are in a state of equilibrium. If you look in this slide, see here, the homeostasis is maintained between the parasympathetic nervous activity and the sympathetic activity. So the parasympathetic activity and the sympathetic activity, they are in a dynamic balance between the autonomic branches. So they maintain homeostasis. They have to maintain homeostasis. So if you look at this particular side, the left-hand side, this gentleman is nicely relaxing, he's sleeping, taking rest. So this parasympathetic activity or the parasympathetic nervous system is associated with rest and digest. So this is assimilation, rest and digest. Whereas if you look at this sympathetic activity, it is mainly associated with a phenomenon which is called as fight or flight. So fight and flight phenomenon, which is mainly seen with the sympathetic activity, or parasympathetic activity, which is rest and digest. And of course, these two are divisions have opposing effects, and normally their effects are in a state of equilibrium. Okay, right. So stimulation, or the prime function of the sympathetic nervous system, is to help a person to adjust to stress and prepare the body for flight or fight reactions, while the parasympathetic mainly participates in the tissue building reactions. Okay, it is helpful for the tissue building reactions or assimilation power, that is rest and digest. Okay, now after knowing this basic concept and introduction, where this autonomic nervous system, which is an involuntary nervous system or the vegetative nervous system, we'll look into. There's another system which is called as enteric nervous system, the third one, that I will tell you briefly next few slides. Now, when you look into the central control of the autonomic nervous system, the major limbic regions for emotions which are present in the amygdala. So amygdala consists of the main limbic region for emotions. So here, I'm sorry, so limbic lobe, okay, here in the brain we have the limbic lobe or the limbic region, which is mainly for the emotional input. And this emotional input, okay, is under the control of the cerebral cortex, okay, and it communicates with the cerebral cortex, and also it communicates with the hypothalamus. So it has a subconscious level of communication. This limbic lobe, which is the emotional region in the brain, which has a subconscious communication with the cerebral cortex, as well as the hypothalamus, which is the overall integration system or the overall integration control or integration system of the ANS. And this hypothalamus is called the boss of the autonomic nervous system. Then there is one more thing which is called as a reticular formation of the brainstem. So reticular formation of the brainstem is regulating the pupil size, the pupillary size. It is regulating the respiration, the heart, the blood pressure, and swallowing. So reticular formation of the brain, regulation of the pupil, pupillary size, the respiration, heart, blood pressure, and swallowing. The spinal cord, it is mainly controls the urination, the defecation, as well as the erection and ejaculation reflexes. So when you look at this particular slide, the amygdala, which is the main limbic region for emotions, they have subconscious level of communication between the hypothalamus, the reticular formation of the brainstem, and the spinal cord, and above the cerebral cortex. So these stimulates the sympathetic activity, especially previously learned fear related behavior. Okay, it can be voluntary when to decide to recall the frightful experience which is taken up at the level of the cerebral cortex, and it acts through the amygdala, which is the emotion control. So there's an emotional input. Okay, right. Not only that, some people can regulate some autonomic activities by gaining extraordinary control over their emotions. As I told you, a hypothalamus, which is called as the boss of the ANS, which is the main integrating center. The reticulum formation is the most direct influence over the autonomic function. Now, the central organization of ANS, medulla oblongata, it directly acts on the cardiovascular system, the respiratory system, the urinary, the reproductive system, and the digestive systems. Whereas the hypothalamus, which regulates the body temperature, the hunger, thirst, and also it regulates the medulla. The limbic system, which controls the visceral responses that reflects the emotions. Then there are certain similarities in the autonomic nervous system, where there is a high level of integrity which occurs in the brain, and it has an ability to influence. It has an ability to influence functions at distant organs. Okay, it has the ability to influence the functions at the distant organs, and it uses the negative feedback mechanism, and it uses the chemicals for transmission of information. These are the similarities in the autonomic nervous system. That is high level of integrity in the brain, ability to influence the functions of the distant organs. It can use the negative feedback mechanism. It can use the chemicals which are essential for the transmission of the information. These are the similarities. Now, we'll look into the brief differences between the somatic and autonomic nervous system. The somatic nervous system is called as voluntary nervous system. Autonomic is involuntary nervous system. So the somatic nervous system, it is mainly present in the skeletal muscle, whereas autonomic is the smooth and cardiac muscle, and the innervation is in the glands. So somatic is for locomotion and postures, and autonomic, it is unconscious regulation. And this is conscious and unconscious movement. Which one? Somatic. So it is both conscious and unconscious movement. Then we have the target tissues stimulated or inhibited. Where in the autonomic nervous system, the target tissues are either stimulated or they are inhibited. Whereas the skeletal muscles, they are contracting. So in the somatic nervous system, we have only one synapse, whereas there are two synapses. There's presynaptic and postsynaptic in autonomic nervous system. There are no ganglia in the somatic nervous system, whereas acetylcholine is released at the preganglionic neurons, and acetylcholine or norepinephrine is released at the postganglionic neurons. Whereas in the somatic nervous system, only acetylcholine is released. And in the somatic nervous system, the nerves are myelinated, and denervation in the somatic nervous system may result in an effect where the muscles may go into paralysis. Whereas here, the autonomic nervous system, it has a property of supersensitivity. But whereas here in the somatic nervous system, this supersensitivity is not available. So here, when you talk about the somatic nervous system, the nerves are myelinated, whereas the preganglionic fibers are myelinated, postganglionic fibers are non-myelinated in the autonomic nervous system. Now, when you look into the axon of the first neuron, which leaves the central nervous system to synapse with the second neuron. Okay, so the axon of the first neuron, which is called as a preganglionic neuron, which leaves the central nervous system to synapse with the second neuron, which is called as the ganglionic neuron. And the axon of the second neuron, which is called as the ganglionic neuron, it extends to the organ where it innervates the organ. Okay, so if you look at the diagram in contrast to the somatic, so here this is a somatic nervous system, here this is a autonomic nervous system. If you look at autonomic nervous system, the somatic nervous system, you have somatic motor neuron, which starts from the ventral nerve root. Okay, so it starts from the ventral nerve root, and if you look at this, it is totally myelinated till the site of innervation. Okay, it is the ventral root. Whereas the autonomic neuron, which starts from the dorsal root of the spinal cord. Okay, and from the dorsal root, if you look at this preganglionic neuron, it is myelinated, or the preganglionic axon, which is myelinated. Okay, and this preganglionic neuron, where it enters into the autonomic ganglion, and from there the postganglionic neuron or axon, it comes out, which is non-myelinated, and that is innervating the smooth muscles or the glands in the visceral organs, or in the intestines, or in the uterus, or in the lungs, or in the heart, so on and so forth. So this is the difference, major difference. What is the major difference? That somatic neuron, it exits from the spinal cord, that is through a ventral nerve root, and autonomic ganglion through the dorsal nerve root. Okay, if you look at this slide, here on the right hand side we have this parasympathetic division, left hand side we have the sympathetic division. Okay. So this parasympathetic nervous system, uh, it exits from exactly what is called as the craniosacral outflow. That is from the medulla to the third cranial nerve, seventh, ninth, and 10th cranial nerve. It is going and getting innervated, or it will supply to the eye, the lacrimal gland, the salivary gland, the heart, lung, and the upper GIT. Okay. When you look at the sacral division, it is going to innervate through the nervi erigantis, through the pelvic ganglia, into the lower GIT, the bladder, and the genitalia. So that is what is the parasympathetic nervous system. It is called as the craniosacral outflow. When you look at the sympathetic nervous system, it is called as the thoracolumbar outflow. Thoracolumbar outflow. Okay. So this thoracolumbar outflow also, there are chain of ganglion which are called as paravertebral sympathetic chain, which is present bilaterally. So that side also we have this chain, paravertebral sympathetic chain, with having lot of ganglion, and this sympathetic nervous system also supplies the structures of the head and neck, the eye, the blood vessels, the salivary glands, etc. It also supplies the heart, the lungs, adrenal medulla, and the prevertebral ganglion. It will supply the liver, the GIT, the bladder, the genitalia, the blood vessels, the sweat glands, etc. Now, what are the anatomical differences in the sympathetic nervous system? If you look at this sympathetic nervous system, you have a preganglionic fiber which arises from the ventral nerve root. And this preganglionic fiber, it is short. Okay. So the neurotransmitter at the level of the preganglionic neuron, it is acetylcholine, whereas the postganglionic, it is norepinephrine, with few exemptions like the preganglionic sympathetic pathway. The neurotransmitter is acetylcholine, and postganglionic also is acetylcholine when it is supplying the sweat glands, pyroelector muscle, or when it is directly innervating the adrenal medulla. Okay. Now, when you look at the parasympathetic nervous system, the preganglionic fiber is myelinated, which is very long. Okay. And you can see acetylcholine is a neurotransmitter here. And where it is innervating also, acetylcholine is the neurotransmitter. So the preganglionic fiber in the parasympathetic nervous system is very longer when compared to that of the preganglionic fiber in the sympathetic nervous system. The postganglionic fibers in the sympathetic nervous system, it is very longer when compared to that of the parasympathetic nervous system. Okay. Now, here this particular slide, it shows the parasympathetic innervation. Okay. When you look at the parasympathetic innervation, so here it is supplying the cardiac and smooth muscle glands and the nerve terminals, where the preganglionic as well as the postganglionic neurotransmitter is acetylcholine. When you see this sympathetic nervous system, the sweat glands, this is something an exception. The preganglionic neurotransmitter acetylcholine. The postganglionic neurotransmitter is also acetylcholine. Okay, so it is supplying the sweat glands. So these are the muscarinic receptors and these are the nicotinic receptors. Then when you look at the sympathetic cardiac and the cardiac and smooth muscles, gland cells, nerve terminals, you see the acetylcholine is presynaptic neurotransmitter, norepinephrine is postsynaptic neurotransmitter. When you look at the renal vascular smooth muscle, in the renal vascular smooth muscle, the sympathetic presynaptic neurotransmitter is acetylcholine, whereas post ganglionic or postsynaptic neurotransmitter is dopamine. So it is dopamine. Okay, that is synaptic or sympathetic renal vascular smooth muscle innervation. Postsynaptic neurotransmitter is dopamine. Please remember. Now you see here this the sympathetic nerve which is supplying the directly to the adrenal medulla, where the postsynaptic neurotransmitters, again, epinephrine or norepinephrine. And then when you look at the voluntary motor nerve, which is arising from the spinal cord, it is totally a myelinated nerve fiber, and it is supplying the skeletal muscle, that is the somatic nervous system, through nicotinic receptors. The neurotransmitter is acetylcholine. So these are the various differences what you have to know. And apart from that, as I told you, there's one more thing which is called as somatic nervous system, autonomic nervous system. In autonomic, we have what is called as the sympathetic and parasympathetic and enteric nervous system. So this enteric nervous system was named by Goyal and Hirana in 1996. And in this, the neurons whose cell bodies lie within the intramural plexus of the wall of the intestine, and they extend from the esophagus to the distal colon. So these plexuses, they are called as myenteric plexus, which are also called as submucous plexuses. They are involved in both motor and secretory activities. And the neurons, they are called as the neurons. They contain mechanoreceptors, they contain chemoreceptors, which providing local pathways that can control the GIT functions without external input. So the neurons which are present in the GIT, that is the enteric nervous system, that is either the myenteric plexus or the submucous plexus or Auerbach's plexus and the mesenteric plexus. So these neurons, they contain mechano and chemoreceptors, which provide the local pathways that can control the functions of the gastrointestinal tract without external inputs. Now, sorry, the innervation of the autonomic nervous system, if you look at, most of the viscera receive most of the viscera receive nerve fibers from both the parasympathetic and sympathetic divisions. Both divisions do not normally innervate an organ equally. However, it is an overall simplified statement and not a rule. So most of the viscera receive nerve fibers from both parasympathetic and sympathetic divisions, and both the divisions do not normally innervate an organ equally. So however, it is an oversimplified statement and not a rule. And activation on the specific structures may be either discrete and independent, or it could be integrated and interdependent, depending upon the neurotransmitters which are involved. Now, when you look at what do you mean by dual innervation? So dual innervation is, for example, antagonistic effects. So whenever the organ or the gland has dual innervation, means sympathetic innervation as well as a parasympathetic innervation, so they produce antagonistic effects. For example, they oppose each other, and these opposing effects are exerted through dual innervation of the same effector. For example, the parasympathetic nervous system, when it is in the activity of parasympathetic nervous system on the heart rate is, it reduces the heart rate. So there's a negative effect on the cardiac. So it is having a reduction in the heart rate. When you look at the sympathetic nervous system on the heart, it increases the heart rate. So they are opposing the effects. So sympathetic increases the heart rate, parasympathetic decreases the heart rate. It is through vagal. See, heart rate is reducing through parasympathetic is through vagal innervation. Then the opposing effects are exerted because each division innervates different cells. For example, there are muscles in the pupil which are called as dilator muscles or dilator pupillae. So the pupillary dilator muscle dilates the pupil, which is through sympathetic innervation, and the constrictor pupillae, which is through parasympathetic, it constricts the pupil. So this is an opposing action. Then we have the actions which are complementary to each other. For example, on the salivary gland, there is an increased secretion. There is an increased secretion, and the secretion is more watery in the presence of parasympathetic stimulation. Similarly, there is increased secretion even when sympathetic nervous system, but the secretion is more viscid when compared to that of parasympathetic secretion. And the parasympathetic stimulation will cause vasodilatation and responsible for erection of penis and clitoris in females. Okay. And the sympathetic stimulation will cause ejaculation of semen in males and reflex peristalsis in females. So these are opposing actions. And on the cholinergic, the only cholinergic stimulation may result in the blood vessels which have the muscarinic receptors only and no parasympathetic innervation. So they have only cholinergic, which is seen in the blood vessels. They have muscarinic receptors only, and they are not parasympathetic involved. Hence, they respond to exogenously given acetylcholine. Now, what are the exceptions in this innervation of sympathetic and parasympathetic nervous system? When you look into the sympathetic only exception, the radial muscles of the iris or smooth muscles of the eyelids, nictitating membrane, the pilomotor muscle, ventricular myocardium, bladder neck, that is trigone of the bladder neck, and the seminal vesicles and the vas deferens are supplied only by the sympathetic nervous system. Then this only parasympathetic nervous system is supplying the circular muscles of the iris, the ciliary muscle, the lacrimal gland, the mucous membranes of the GIT, and the bronchial tree. Okay, pancreatic exocrine glands, detrusor muscle of the bladder, erectile tissue of the penis. So they only have the parasympathetic supply, and only adrenergic receptors are present in adipocytes. So adipose tissues or the adipose cells, there are only adrenergic receptors which are meant for lipolysis. And in the liver, the adrenergic receptors which are present in the liver cells, they are helpful in gluconeogenesis. They are helpful in gluconeogenesis. Then when you look at the adrenergic receptors which are present in the skeletal muscles, which are helpful for glycolysis, they do have beta receptors only, but no sympathetic innervation is seen. So they are having beta receptors, but there is no sympathetic innervation in the skeletal muscles. Why there is no sympathetic? Because the acetylcholine, the skeletal muscle, it is mainly supplied. The post ganglionic or neurotransmitter is also acetylcholine. Preganglionic is also acetylcholine. Okay, so there is no sympathetic innervation in the skeletal muscle, but still they have beta receptors, so which is helpful for glycolysis. When you look at this parasympathetic division, which is also called as trophotropic activity, which is mainly having digestion, defecation, diuresis actions. So rest and digest, as I told you, rest and digest is the main criteria of parasympathetic nervous system. And this parasympathetic activation results in decreased cardiac activity, as I already told you. It results in secretion of watery saliva and stimulation of gastrointestinal secretions. And it causes the contraction of the urinary bladder. It causes increased insulin and glucagon secretion, and it causes bronchiolar constriction. Then when you look at sympathetic division, this sympathetic activity is called as ergotrophic activity, where it increases the cardiac activity, it increases the blood pressure, it causes dilatation of the skeletal muscle blood vessels, it causes constriction of the blood vessels in the skin, it causes dilatation of the pupil, it inhibits the GIT and urinary bladder contractions, it increases the blood glucose and free fatty acid levels, it causes dilatation of the bronchial smooth muscle, it lowers the threshold for reticular formation activation, and in the liver, it produces the glucose to provide energy for muscle contraction. So these are all the ergotropic effects of the sympathetic nervous system. After knowing the various effects of the parasympathetic and sympathetic nervous system, you should know what is the basic terminologies which are used in the nervous system, ANS. We have one which is called as synapse. A synapse is a structure formed by the close opposition of a neuron with another neuron or an effector cell. That is called as a synapse. So neuron to neuron or neuron to an effector cell is called as a synapse, and in where the neurotransmitter is actually released. Then what is a ganglion? Ganglion is nothing but a synapse between a preganglionic and postganglionic fibers. So the synapse between preganglionic and postganglionic fibers is called as a ganglion. So what is neuroeffector junction? It is a junction between the postganglionic fiber and the receptor, which is called as a neuroeffector junction. So what is transmission? Transmission is nothing but passage of impulse across a synapse is called as a transmission. Now, then other terminologies we have conduction. So conduction is nothing but an impulse which is carried along the pre or the post ganglionic fibers. And what is neurohumoral transmission? It is nothing but an impulse which occurs as a result of the release of neurotransmitter into the synaptic cleft. So neurohumoral transmission is nothing but an impulse which is generating as a result of the release of neurotransmitter in the synaptic cleft is called as a neurohumoral transmission. So what is this synaptic cleft? Synaptic cleft is the space between the pre and the post ganglionic fibers or between the nerve ending and the receptor. What is IFA phase? Okay, IFA phase is nothing but a transmission of electrical impulses in the crayfish and annelids. So it's nothing but a transmission of electrical impulses in a crayfish or annelids, IPA phase. Then what are these neurotransmitters? So neurotransmitters are the chemical substances which are released into the synaptic cleft to rapidly stimulate or inhibit the post-synaptic neurons or the receptors. Okay, then what is neurotransmission? The neurotransmission is the process by which an impulse is transmitted across the synapse between the two neurons. And what are the neuromodulators? So these neuromodulators or the neuromediators are nothing but the second messengers. And these second messengers, for example, cyclic AMP, cyclic GMP, IP3, inositol triphosphate, elicitation, postsynaptic reflexes. So cyclic AMP, cyclic GMP, IP3, eliciting postsynaptic responses are called as neuromediators. They are also called as second messengers. Now, there are other terms which are called as neuromodulator. So what is this neuromodulator? It is nothing but the mediator which increases or decreases the efficacy or the efficiency of synaptic transmission. So modulator means it can increase or it can decrease the efficiency of the synaptic transmission. For example, pre and post synaptic effects, which is a neuromodulatory effect. What is a neurohormone? So hypothalamic hormones are called as neurohormones. What are neurosteroids and neuropeptides? So these neurosteroids and neuropeptides, they cause neurogenic inflammation. The examples are neurokinin A and substance P. Neurokinin A and substance P are the neurosteroids or neuropeptides which cause neurogenic inflammation. And apart from that, we have neurotropic factors. And these neurotropic factors, they are actually produced by the neurons, by the CNS or in the CNS, which is called as BDNF, that is brain-derived neurogenic factor, BDNF alpha, like that. Then we have neurotransmitters. What are the neurotransmitters which are present in the autonomic nervous system? When you talk about the cholinergic fibers, which release the neurotransmitter acetylcholine, all ANS in all the autonomic nervous system preganglionic axons and all parasympathetic postganglionic axons. Okay, and all parasympathetic postganglionic, all ANS preganglionic axons, acetylcholine is the neurotransmitter, and in all parasympathetic postganglionic axons, acetylcholine is the neurotransmitter. When you talk about adrenergic fibers, which release the neurotransmitter norepinephrine, cholinergic fibers, neurotransmitter is acetylcholine, adrenergic fibers, neurotransmitter is norepinephrine, and most of the sympathetic postganglionic axons, except sympathetic postganglionic fibers which secrete acetylcholine at the sweat glands and some blood vessels in the skeletal muscles, and not only that, piloerector muscle and the adrenal medulla. The exception is acetylcholine, which is the neurotransmitter in the sympathetic postganglionic fibers. Now, when you look at this autonomic ANS neurotransmission, we have a synaptic site, the neurotransmitters, and the receptor. What is the sympathetic effector in the synaptic site? Norepinephrine is the neurotransmitter, the synaptic effector site. The adrenergic receptors like alpha and beta receptors are the receptors. Parasympathetic effector, we have acetylcholine neurotransmitter. The receptor is muscarinic receptors. The parasympathetic ganglion, if there is a parasympathetic ganglion with a synaptic site, acetylcholine is the neurotransmitter, and nicotinic N1 receptors are present in the parasympathetic ganglion. When you talk about sympathetic ganglion, acetylcholine is the neurotransmitter, nicotinic, that is N1 receptors are the present in the sympathetic ganglion. The adrenal medulla, acetylcholine is the neurotransmitter, nicotinic N1 receptors are involved. Neuromuscular junction, acetylcholine is a neurotransmitter, nicotinic N2 receptors are involved in the neuromuscular junction, especially innervating the skeletal muscles. That is regarding the neurotransmitters, neurotransmission which occurs in the autonomic nervous system. Then what are these neurotransmitters? The acetylcholine and norepinephrine are the primary neurotransmitters which are present in the autonomic nervous system. But apart from that, we do have NANC, non-adrenergic, non-cholinergic neurotransmitters. Non-adrenergic, non-cholinergic neurotransmitters like adenosine, okay, and ATP, peptides, some peptides, adenosine, ATP, they are the non-adrenergic, non-cholinergic neurotransmitters. Then we do have some co-transmitters also present. They are ATP, cholecystokinin, dopamine, enkephalin, galamine, GABA, neuropeptide Y, 5-hydroxytryptamine, VIP, vasoactive intestinal peptide, substance P, and nitric oxide. All these are the co-transmitters. Okay, they are also the neurotransmitters or co-transmitters like ATP, CCK, dopamine, enkephalin, galamine, GABA, gamma aminobutyric acid, neuropeptide Y, 5-hydroxytryptamine, vasoactive intestinal peptide, substance P, nitric oxide. So this neuropeptide Y consists of sympathetic activity, whereas vasoactive intestinal peptide is mainly for the parasympathetic activity. Now, what are the neurotransmitter effects? The effect is either a stimulatory or inhibitory effect. For example, autonomic nervous system effect on the target organ is dependent upon the neurotransmitter released. And it is also dependent upon the type of receptor, the type of the effector, and the effects. There might be slower in onset, and many effector cells, they do not have button-like action. So just switch on, switch off action is never seen in many effector cells. Now, there are certain neurotransmitters which are called as small molecular neurotransmitters and neurotransmitters which are called as peptide neurotransmitters. So what are these small molecular neurotransmitters? Like acetylcholine, norepinephrine, dopamine, epinephrine, and serotonin or 5-hydroxytryptamine. These are all the smaller molecular neurotransmitters. Then the neurotransmitters which are peptides are VIP, somatostatin, enkephalin, neurotensin, cholecystokinin, enkephalin, and substance P, and thyrotropin releasing hormone. Now, what are the classes of these neurotransmitters? As we have seen, the small molecular neurotransmitters, they are classical transmitters and synthesized in the cytoplasm from the compounds of the intermediary metabolism. For example, if you look at acetylcholine, is a classical example of small molecular neurotransmitters. Then we do have this biogenic amines. They are dopamine, norepinephrine, epinephrine, serotonin, and histamine. We have amino acids as neurotransmitters like GABA, that is gamma aminobutyric acid, glycine, and glutamate. The nitric oxide is a small diatomic gas that is also a free radical, and this is also called as endothelial derived relaxing factor, that is EDRF. Very important. Now, when you look into the classes of neurotransmitters, we have neuroactive peptides. These are actually synthesized on the rough endoplasmic reticulum and processed for secretion by the Golgi apparatus. And in this, we have hypothalamic releasing hormones, neurohypophyseal hormones like vasopressin, it is also called as antidiuretic hormone, and oxytocin. We have adenohypophyseal hormones, they are the growth hormones, endorphins, MSH, melanocyte stimulating hormones, the other neuroactive peptides. Then we have gastrointestinal peptides like gastrin, substance P, insulin, glucagon, vasoactive intestinal peptide. And there are others in the class of neurotransmitters like angiotensin, bradykinin, and sleep peptides. When you look at NANC, that is non-adrenergic, non-cholinergic transmission in the ANS, it mainly releases the purines, the ATP and adenosine, etc., which are the NANC neurotransmitters. And if you look at adenosine, its effects are vasodilatation, and it inhibits the platelet aggregation. It causes a transient bronchoconstriction, and neuroprotection also is an effect of adenosine. And when you look at these neurotransmitters, they are synthesized in the presynaptic neuron, and they are localized in the presynaptic neurons, in the vesicles in the presynaptic neurons, and finally released from the presynaptic neuron under physiological conditions. So what are the fate of these neurotransmitters? They are synthesized in the presynaptic neuron, which are localized to the vesicles in the presynaptic neuron, and finally released from the presynaptic neuron under physiological conditions. Now, not only that, if you look at these neurotransmitters, they are rapidly removed from the synaptic cleft by a mechanism which is called as a uptake or degradation mechanism. So there might be a reuptake phenomenon, or they might be degraded or metabolized. And not only this, neurotransmitters which are in the presence of a receptor on the postsynaptic neuron and binding to the receptor elicits a biological response. So in this neurotransmitter. So when you look at this acetylcholine, there's one diagram which I would like to explain the synthesis of this acetylcholine, how it is synthesized and how it is stored and how it is metabolized. So this acetylcholine, it is released by a process called as exocytosis during nerve depolarization and acts on nicotinic and muscarinic receptors. And the action is terminated by an enzyme which is called as acetylcholinesterase. And there are two types of acetylcholinesterases, acetylcholinesterase and pseudocholinesterase. There are two enzymes which are present. So if you look at this picture, you see this is a presynaptic axon and this is a presynaptic neuron. Okay, now in this particular diagram, if you see this choline in the presence of acetyl coenzyme A, the acetylcholine is formed, okay, in the presence of choline acetyl transferase. And this choline acetyl transferase it forms the combination of choline and acetyl CoA, which the acetyl CoA is derived from the mitochondria, and this choline is from the hemicholinum, which is entering into the nerve fiber, that is preganglionic nerve fiber. In the presence of choline acetyl transferase forms acetylcholine, and this acetylcholine is stored in the vesicles as acetylcholine and ATP and phosphate. Finally, the stimulation of these presynaptic receptors will result in the release of acetylcholine in the synaptic cleft, and this acetylcholine is taken up by the cholinereceptors, and it is taken up by the cholinereceptors on the postsynaptic cell, and there's an enzyme which is called as acetylcholinesterase, and this acetylcholine is rapidly degraded again into choline and acetate. Okay, so acetylcholine as such, it is a neurotransmitter which is very, very rapidly metabolized. It is very, very rapidly metabolized, and hence we don't have the therapeutic, it is not used as therapeutics. in the therapy of mankind, we don't use acetylcholine, but acetylcholine uh, is used especially for experimental purposes in bioassays and so on and so forth. But acetylcholine, it is very, very rapidly degraded in the presence of acetylcholinesterases in the synaptic cleft to choline and acetate. And again, this choline is taken up by acetylcholine autoreceptor in the presynaptic receptor. Okay, right? It is taken up again. And then again, acetylcholine is formed. This is how it goes on. Now, when you look at these catecholamines or non-epinephrine and epinephrine, so this termination of catecholamines and dopamine, norepinephrine, epinephrine, and dopamine. So these catecholamines, the metabolism or termination of action, it is mainly by the reuptake mechanism through the diffusion process as well as the metabolism. And these are metabolized rapidly by COMT, that is catechol-O-methyltransferase, in the postsynaptic neurons and the liver and the kidney. And not only that, there's another enzyme which is called as MAO, the monoamine oxidase and catechol-O-methyltransferase are the two enzymes which metabolize the catecholamines. And this MAO, monoamine oxidase, is present in the postsynaptic presynaptic neurons of the blood, and monoamine oxidase A, where the catecholamines are norepinephrine and serotonin. MAO B, that is monoamine oxidase B, the neurotransmitter is dopamine. So if you look at this slide where this norepinephrine and all these things are synthesized in the presence of tyrosine. Okay, tyrosine in the presence of tyrosine hydroxylase is converted to DOPA. DOPA decarboxylase converts DOPA to dopamine, and this dopamine is converted to VMAT. It's converted by VMAT, and it is stored in the vesicles as norepinephrine, and then norepinephrine, ATP, and phosphate. With further stimulation of the nerve impulse, it is secreted into the synapse as norepinephrine and ATP and phosphate. And not only that, this norepinephrine is bound to the adrenoreceptors. It could be the beta receptors or the alpha receptors. Okay, and this norepinephrine also is through another mechanism, through autoreceptors is taken up, or it is diffused into the synaptic cleft. Okay, so this is how this particular catecholamines are synthesized. For example, through tyrosine, and tyrosine in the presence of tyrosine hydroxylase that converted to DOPA. DOPA decarboxylase converts DOPA to dopamine, dopamine to norepinephrine, and then we have released into the synaptic cleft as now norepinephrine, and it is diffused or taken up by the adrenoreceptors for the confirmation of action or the effects at the target tissues and so on and so forth. Now, when you talk about the reuptake mechanisms in the neurotransmitters, there are two reuptake mechanisms, that is reuptake 1, reuptake 2. The reuptake mechanism 1 occurs by the axoplasm of the adrenergic neuron and other extraneuronal cells to storage, or there is retention. So in this reuptake 1 mechanism, there is retention of the neurotransmitter up to 75 to 80%. And there's another mechanism which is called as uptake 2, where there is a picking up of the neurotransmitter by the effector cells in the peripheral tissues. And this will result in rapid degradation. And the neurotransmitters where there's rapid degradation is adrenaline, isoprenaline, than norepinephrine. So rapid degradation occurs in adrenaline, followed by isoprenaline, and then least degraded is norepinephrine. Then finally, the uptake mechanisms 1 and uptake mechanisms 2. So uptake mechanism 1 is a retention mechanism whereby the axoplasm of the adrenergic neuron or other extraneuronal cells, there is storage of this neurotransmitter up to 75 to 80%. Reuptake 2 is either picking up by the effector cells in the peripheral tissues resulting in rapid degradation of adrenaline or isoprenaline and then norepinephrine, followed by reuptake, followed by metabolism, where it is low affinity and high capacity by catecholomethyl transferase, monoamine oxidases, and sulfotransferases, the metabolism will occur. Now, what are the inhibitors of the reuptake mechanisms? So reuptake 1, norepinephrine receptor 1. So the drugs which are going to inhibit the reuptake 1 mechanism are cocaine, tricyclic antidepressants, phenoxybenzamine, amphetamine, monoamine oxidase inhibitors, and chlorpromazine. So these are the inhibitors of reuptake 1 mechanism. So inhibitors of reuptake 2 are normetanephrine, glucocorticoids, and phenoxybenzamine. So phenoxybenzamine, glucocorticoids, and normetanephrine are the inhibitors of reuptake 2 mechanism. So what are these reuptake inhibitors? For example, if you look at these reuptake inhibitors like atomoxetine, which is a selective inhibitor of norepinephrine neurotransmitter, it is mainly used in the treatment of attention deficit hyperactivity disorder. Then we have this sibutramine, which acts on the SERT and norepinephrine neurotransmitter, which is used to suppress the appetite. So it suppresses the appetite, and hence it is used in the treatment of obesity. So they are appetite suppressant, and the long-term treatment of obesity we give sibutramine. Then we have another thing which is an antidepressant. Again, they are the reuptake inhibitors like duloxetine and venlafaxine. Venlafaxine and duloxetine, they are the antidepressant drugs. So now we will go to the next aspect of the autonomic nervous system, where the autonomic nervous system and their receptors. So these receptors are very important. Now, the parasympathetic receptors are the muscarinic and nicotinic receptors. The muscarinic receptors are M1, M2, M3, M4, and M5. Nicotinic receptors are nicotinic NM and NN. So this neuromuscular NM is present in the skeletal muscle especially, and NN is present in the CNS. Then we have this sympathetic nervous system. They consist of adrenergic receptors like alpha and beta. So alpha 1, alpha 2, beta 1, beta 2, and beta 3. Dopaminergic are D1, D2, D3, D4, and D5. So they are a D1 and D2 like receptors. So this presynaptic norepinephrine, it mainly consists of alpha 2A and alpha 2C receptors, and presynaptic norepinephrine, it also consists of acetylcholine, that is M2 and M4 type of receptors are present in the presynaptic acetylcholine receptors. Now we will look into exactly what are these parasympathetic receptors and the sympathetic receptors. So these parasympathetic receptors, we look into M1, M2, M3, which are mainly involved, and of course their M4 and M5 are also there, but we are mainly focusing upon M1, M2, M3. So it is basically the characteristic of muscarinic receptors with respect to location, functions, and mechanisms. When you talk about the location of M1, just remember M1, that is neural, ganglion, gastric, paracrine cells, and the central nervous system. So neural location is neural, ganglions, gastric paracrine cells, and the CNS. M2 are cardiac. So M1, that is, you look into the head, that is CNS, M1. M2, the cardiac, the SA node, AV node, atrium, ventricle, neural presynaptic terminals. And M3, they are the exocrine in nature. They are supplying they are present in the smooth muscles, vascular endothelium, that is M3 receptor. That is the location of M1, that is the neural, ganglion, gastric, paracrine cells, and the CNS. M2 are the cardiac, and M3 are the exocrine, the smooth muscles, vascular endothelium. What are the functions of these M1? So the functions of M1 are they result in gastric acid secretion, they increase the GI motility, they cause CNS excitation. And the M2 receptors which are present in the the cardiac, they cause the SA node. So they act on the SA node, decrease the rate of impulse generation. They reduce the AV nodal velocity of the conduction. They reduce the AV nodal conduction velocity. They reduce the contractility, and they cause bradycardia due to vagal effects. And on the M3, generally what happens on the M3, the functions are they increase the exocrine secretions, the smooth muscle contraction. Okay, that is the thing. So yeah, velocity, CITY. Okay. Okay. Then, if you look at the mechanism of these particular M1 receptors, they act by increasing the IP3-DAG. So, they increases the inositol triphosphate and diacylglycerol pathway. They cause cytoplasmic release of calcium, resulting in depolarization. And apart from that, M2 receptors, they cause inhibition of adenylyl cyclase and opening of potassium channels, and hence inhibit the calcium channels. So the mechanism of M3 receptors is again they cause increased IP3-DAG pathway. They cause increased cytoplasmic calcium, resulting in depolarization. That is M3 receptors. Then when you look at the nicotinic receptors, so these nicotinic receptors, as I told you, NM and NN, and neuromuscular and nicotinic neuronal. Okay, nicotinic muscular, nicotinic neuronal. So when you talk about this NM type and NN type, so location of NM type, that is skeletal muscle neuromuscular junction, they are the postsynaptic receptors. And the neuronal type, all the autonomic ganglion, the adrenal medulla, and the postsynaptic or the postsynaptic ganglion. And in the CNS, they are the sensory nerve terminals and mostly postsynaptic neurons. What are the functions, especially of NM type of nicotinic receptors? They cause contraction of the skeletal muscle. And NN type, they cause transmission of impulse, especially through the ganglion, firing the postsynaptic neuron, and secretion of the norepinephrine and epinephrine from the adrenal medulla. And when you talk about the CNS, their function especially is presynaptic facilitation of the release of dopamine and glutamate in the CNS. So when you look into the mechanism of action of the NM type, they are ligand-gated sodium channels. And it is again the same, the ligand-gated sodium channels, there is a mechanism is unclear. When you look into the agonists, especially the NM type, that is acetylcholine is the agonist, S-choline, PTMA, and nicotine, they are the agonists at muscular NM type of receptors. Whereas neuronal type of receptors, we have nicotine, DMPP, and epibatidine. They are the agonists. Then coming to the antagonists at neuromuscular junction, we have D-tibocurarin and alpha bungarotoxin. Whereas nicotinic neuronal, the antagonists are hexamethonium and trimethophan. They are the antagonists at the nicotinic neuronal type of receptors. When you talk about this adrenoreceptors, we are having alpha 1 and alpha 2 receptors. The location of alpha 1, it is postsynaptic, and they are postsynaptically located. They're located on the smooth muscles, they're located on the salivary glands, they're on the liver cells. And this is GQ protein. And it is the second messenger is increased IP3 and DAG, which increases the calcium concentration and resulting in contraction, and it increases the secretions. And if you look at the alpha 2 receptors, they are located presynaptically. They are presynaptic adrenergic and cholinergic nerve terminals. They are located in the brain postsynaptically. Beta cells of the pancreas, vascular smooth muscle, GI, that is inhibitory in nature. They are stimulatory, they are inhibitory in nature. They cause decreased in the cyclic AMP, which is the second messenger, and they cause decreased norepinephrine release. They cause central sympathetic outflow, increase insulin release, and they result in also vasoconstriction. When you look at the beta adrenoreceptors, So these beta adrenoreceptors are again divided into beta 1, beta 2, and beta 3. The location of beta 1 is postsynaptic at the cardiac muscle and juxtaglomeralular apparatus, presynaptic at the adrenergic and cholinergic nerve terminals. And they are that is stimulatory. G protein is GS protein, and they cause increased cyclic MP, and they increase the heart rate, they increase the force of contraction of the heart, and they release the renin. They cause the release of renin. Then beta 2 receptors are located post and presynaptically in the bronchi. They are located in the coronary arteries, and not only that, they are located in the uterus as well as the smooth muscles, and they are also located in the myocardium. They are also located in the myocardium. Which receptors? They are beta receptors, beta 2 receptors. They are G stimulatory. They increase cyclic AMP, and they cause an increase in the norepinephrine release, resulting in relaxation of the smooth muscles. They cause enhanced glycogenolysis. They increase the heart rate. They increase the force of contraction, that is the beta 2 receptors. Not only that, when you look at the beta 3 receptors, they are present postsynaptically in the adipocytes. They are G stimulatory. They also cause increased cyclic AMP. They cause function is they increase the lipolysis and thermogenesis. Okay. Apart from that, we have this dopamine receptors. The location of dopamine receptor D1, D2, D3, D4, D5 are there, but D1 like and D2 like we look into. So the location of the D1 like are postsynaptic, which are present in the brain, the kidney, the mesenteric vessels, the coronary vascular bed, and the myocardium. They are G stimulatory. Stimulatory receptors, G protein coupled receptors, like they are stimulatory in nature. The second messengers are they cause increase in the cyclic AMP, PIP2, and they cause hydrolysis. And the function of this D1 like are the vasodilatation of the renal blood vessels. Then what are these D2 receptors like? They are mainly present in the CNS, and they are postsynaptic at the nerve terminals and the renal vascular bed. They are the inhibitory, G protein inhibitory neurotransmitter. And the second messengers of these are they decrease the cyclic AMP, they increase the potassium conductance, blocks the calcium channels, and hence their main function is decrease in the norepinephrine release, and they modulate the dopamine release. So this is regarding the dopamine receptors. So then we have the criteria. There are various criteria, and what are the criteria with respect to D1 like and D2 like? So when you talk about the gastric motility and the mucosal blood flow and acid secretions are inhibited by D1 like neurotransmitter, they are stimulated by D2 like neurotransmitters. Then we talk about gastric and duodenal ulcer. So in the gastric and duodenal ulcers, D1 like they have anti-ulcer effect, whereas D2 like they are pro-ulcerogenic. They are pro-ulcerogenic. When you talk about dopamine agonist, the D1 like receptors as a dopamine agonist has low affinity. D2 like they have a high affinity to dopaminergic agonistic activity. When you talk about the agonists, there are SKF 393. We have phenoldopam, pergolide, bromocriptine, which is again a partial agonistic activity at D1 receptor. Then we have this bromocriptine, pergolide, and lisuride, which has D2 like activity, is an agonistic activity at D2 receptor like dopaminergic receptors. When you talk about the antagonists at D1, we have pymoside, clozapine, which has high affinity, and bromocriptine. Then we have D2 like antagonists like sulpiride, domperidone, metoclopramide, haloperidol, and clozapine, which has low affinity. At D1 like antagonistic, clozapine has high affinity. At D2 like antagonistic effect, clozapine has low affinity. So clozapine has both activities at D2 like receptors and D1 like receptors, with D1 high affinity and D2 which has very low affinity. So with this, I think I have covered almost everything, the introduction to the autonomic nervous system. Then we have briefly looked into the central organization of the ANS. Then we have seen into what is called as the neurotransmitters. Then we are looked into the anatomical and physiological aspects of the autonomic nervous system. So what are the salient divisions or the differences between what you call like the various neurotransmitters and then somatic and autonomic nervous system. Then we are looked into various neurotransmitters and what are the various receptors which are involved in the autonomic nervous system. But just remember, autonomic nervous system, it broadly consists of two major pathways. One is the sympathetic nervous system, which is fight and flight, and parasympathetic nervous system, which is rest and digest. So in the sympathetic nervous system, the preganglionic neurotransmitter is acetylcholine, postganglionic neurotransmitter is norepinephrine, with few exceptions like the pyroerector muscle, the sweat glands, and the adrenal medulla, where the neurotransmitter is again acetylcholine in the sympathetic. Whereas if you look at the parasympathetic nervous system, the preganglionic neurotransmitter is exactly what is called as the acetylcholine, and the postganglionic synaptic neurotransmitter is also acetylcholine. So these two autonomic nervous systems, like sympathetic and parasympathetic nervous systems, they are not under voluntary control. And as you already told that it is atos means self, and nomos means governing. It is a Greek term, autonomous. So autonomic nervous system is self-governing nervous system. And these autonomic nervous system, it mainly innervates the heart, the smooth muscles, the glands, the viscera, and controls the functions of these organs. And to sum up, this autonomic nervous system, which is having the two divisions, sympathetic, parasympathetic, they definitely have opposing effects, and normally their effects are in a state of equilibrium. And as I told you, the prime function of sympathetic nervous system is to help a person to adjust to stress and prepare the body for fight and flight reactions, while the parasympathetic mainly participates in the tissue building reactions. And man or the human being can survive and maintain ourselves alive without sympathetic nervous system if maintained stress free, but human being cannot survive without parasympathetic nervous system. So please remember, a man can survive and remain alive without the sympathetic nervous system if he is well maintained and he is totally stress free, but he cannot live without parasympathetic nervous system. So with this brief sum of autonomic nervous system introduction, thank you one and all for your patient listening.